Hello, everybody. This is Dr. Girdhar. I'm one of the family physicians for Access Point Community Health Centers, and May is Mental Health Month. We wanted to discuss a few questions that are pretty common amongst patients and people in regards to mental health. So let's get right to it. So, what does it mean to have a mental illness? Mental illnesses are health conditions that disrupt a patient's emotional well being. This is by affecting their thoughts, emotions, relationships, and daily functioning. They're often caused by anxiety, grief, sadness, or any other forms of distress. And it's usually causing a struggle to continue with their daily activities of living and normal everyday functioning. Now, there's a wide variety of mental illness, some rather mild, such as phobias or tiny fears, and others can be pretty major, such as major depression, anxiety, bipolar disorder, or schizophrenia. Now, who does mental illness affect? Now, on average, mental illness affects 1 in 5 adults in the US, and that's documented. There are so many cases that go undocumented, or patients just feel embarrassed or don't want to seek any treatment by going to speak with their doctor or a healthcare professional about what they might be feeling. But mental illness does not discriminate. It can affect anyone, regardless of age, income, gender, socioeconomic status, religion, sexual orientation, or background. While anyone can have a mental illness, the young and the old are more likely to be affected. About 75% of mental health conditions develop by the age of 24. So, what causes mental illness? Now, the research shows that there are many different factors that go into contributing to mental illness. These are biological factors, environmental factors, social factors. There's also a hereditary component. So it usually isn't pinpointed to just one thing. Now, if there's a family history of, let's say, bipolar disorder or depression, that does mean you might be a little bit more predisposed to developing that condition. Or if you've seen a sibling or parent or grandparent having struggled with a certain condition, it may tend to run in the family and you might be affected as well. Next, are there any warning signs of mental illness? Yes, there are many different warning signs and symptoms of mental health disorders, and these will vary depending on the type of condition. Adults, you may have confused thinking or problems concentrating, long-lasting periods of sadness or irritability, extreme mood swings, avoiding family, friends, dramatic changes in your eating or sleeping habits, feeling tired, fatigued, just having low energy, strong feelings of anger, excessive fear, worrying, or anxiety, delusions or hallucinations, which is pretty much imagining, voices or seeing things that are not really there. In younger children, you might experience a change in their school performance, hyperactive behaviors such as not being able to sit still in class or just talking too much, excessive worrying or anxiety. They might have frequent nightmares. They may be disobedient at home or show aggressive behaviors, including temper tantrums. Next, what are some of the most common types of mental illnesses or disorders? So first we have anxiety and panic attacks. Now, anxiety itself is a normal emotion, usually to stress. But if that worry or anxiety turns into something that causes you to have intrusive thoughts or just racing thoughts to the point where you can't get anything done, and it's affecting your functioning and day-to-day activity, that's when, treatment might be needed. Bipolar disorder. So bipolar, this includes 2 stages of changing mood. Usually in cycles. We have a manic phase where people might feel like they're on cloud 9, on top of the world and untouchable. They might feel they don't need to sleep at all and often do go periods of time without sleep. And then for the next cycle, they will feel the depressive phase. With depression, you'll have low mood, you'll have changes in your sleep cycle, energy levels are down, concentration is down. Might also have feelings of suicide. PTSD, post-traumatic stress disorder, is usually after something traumatic has resulted in symptoms of frequent flashbacks and worry, whereas a little trigger might set off that negative experience and have patients overly anxious and unable to carry out their day-to-day function. So, what treatment options are available? There are many treatment options available. Counselors, psychiatrists, and your medical doctor, aside from medication, can also advise patients to engage in cognitive behavioral therapy, which will allow you to change your thought process. There's support groups, there's family therapy, exercise, and yoga. Usually, counseling combined with medical treatment is shown to have the best benefit. So, hopefully, this has helped answer some of the more common questions regarding mental illness. Working in integrated care, it is very, very often seen that mental health affects our physical health. So, without controlling one, we cannot have good control over the other. So, let's control both of them together. Thank you.